The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we're going to be speaking with Melissa Dale, who's the program's manager for the Montana Falls Prevention Program. We're going to be talking about what is a fall, how do you prevent one in your home, and how do you keep yourself fall prevention ready. So make sure you stay tuned to today's Aging Horizons because you're not going to want to miss this great discussion on how to keep yourself safe from falling here in Montana.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
Final call from like 566.
Hello, gentlemen. May I see your Montana Real IDs?
IDs? Why, I'm Captain Meriwether Lewis.
And I'm Captain William Clark.
Hang on, I see more than one William Clark.
It's the real me, I promise.
Discover more at mtrealid.gov. Available now.
Montana Real ID. It's the real me.
And me.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we're speaking with Melissa Dale, who's the program manager for the Montana Falls Prevention Program. Melissa, thank you so much for being with us today.
Thank you. Thanks for having me on.
I want to talk just a little bit about what the Montana Falls Prevention Program is.
Yeah, so the Montana Falls Prevention Program, we are housed in the Department of Public Health and Human Services. And our mission is to increase the awareness of falls risks and how to prevent them, especially in older adults. And so we work with local communities across Montana to be able to implement evidence-based falls prevention programs. And we'll talk about those classes a little later here.
Sure. I think it sounds kind of self-explanatory, but what is a fall? What counts?
Great question. So the definition of a fall is when a person comes to rest inadvertently on the ground. And that's exactly what we want to prevent. Because sometimes when people fall, they are injured. And so we never know who's going to get injured and why. And so we want to make sure we're preventing falls to prevent injuries. And some falls can be fatal. And so we're trying to prevent all of that there.
Sure. And how big of a problem is falling? How many people fall every year?
So falling, about 1 in every 4 older American adult, 65 and older, are likely to fall each year. And so that is, if you're hanging out with a group of friends, and there's 4 of you guys, at least one of you guys is going to fall this year. And so that's kind of scary to think about. And then if you break it down, the experts have found that about every 11 seconds, a a person is admitted into the emergency room because of a falls injury, and about every 19 minutes, a person dies because of a falls-related injury. Although these numbers are really high, experts actually believe these are actually kind of low because not everybody is reporting when they have fallen down.
Sure.
And here in Montana, I know you talked about nationally, but in Montana, we unfortunately are leading the pack for falls-related injuries and people falling down. And that's just partly because we have an older population in Montana. Recently, we were named the grayest state out in the West, and so we want to help mitigate falls. And so definitely I'm excited to talk about how to reduce your risks.
And who falls? Who's at greatest risk for falling?
So older adults are more likely to fall than any other age. We'll talk about that, why that's happening, but also surprisingly, American Indians have a higher rate of falling, but both American Indians and Caucasians have high rates of falling, but American Indians just have a higher rate. People who are living in rural areas and people who have a disability or some type of limitation have a higher rate of falling. Those who have chronic health conditions, especially if you have arthritis, that can increase your risk of falling. And then surprisingly, both men and women have it fall at an equal amount rate, but women are more likely to sustain an injury after they have fallen. And so those are who we are seeing who are falling more.
And how do people fall?
So people, when I think of falling, I think of somebody doing something reckless, and it's not true. Over 50% of people who have been admitted into the hospital here in Montana, this is Montana data, over 50% is just from slipping or stumbling or tripping over something. So it's actually a fall from the same level. So you're doing something and you just trip over a rug or something like that. Other people, there's some people falling from a ladder or step stool or being on a chair. And then others are from your steps or your stairs. And there are just some also who are falling out of bed. So that's kind of the falls, but because there's such a high rate with falls, just from slipping and stumbling and tripping, we want to talk about that.
Sure. And what kind of injuries do people sustain when they fall?
So the biggest one is pride. You know, when you fall, you just it's your pride, it's hurt. Another injury, and we don't really think about this as an injury, but is fear. After a person falls down, they become very fearful that they're going to fall again. So it's this vicious cycle. So they are fearful that they're going to fall again. So they stop doing some certain activities or stop going out. So they're not likely to fall again. But because of that, they're not keeping their muscle strength up. And so it becomes a vicious cycle that they're fearful, they stop doing activities, they lose muscle mass, become weaker, then they start falling again. And it's just this cycle. Other injuries can be bruising. And then after that, it's some severe injuries, such as the brain injuries, hip injuries. You break a hip. And surprisingly, 95% of hip injuries are caused from falling down.
Wow.
In addition, you can get rib injuries or a spinal injury, or worse, it can be fatal.
That's amazing. And just terrifying that so many people, if 1 in 4 people fall, that's a lot of really serious consequences if people aren't careful.
Mm-hmm.
And so, Melissa, I know that there are probably lots of things that people can do to decrease the risk of falling. So when we get back, I'd like to talk about some of the ways that people can decrease the risk in their homes and hopefully in their communities as well.
Yeah.
Great. All right. Make sure you stay tuned to us. We'll be speaking with Melissa Dale when we get back, all about how to prevent yourself from falling in your home.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. Today we're speaking with Melissa Dale, who's the program manager for the Montana Falls Prevention Program. Melissa, there are a lot of things that you can do in your home to help decrease the risk that you might fall. What are some of those things that you can do?
Yes, so some things that you can do at home to decrease the risk of falling is to check out your physical environment and see what's going on there. The biggest thing that you can do, or a lot of things that you can do, is check to see if you have rugs. I know people like to have rugs, they look really nice, but if they're not tacked down or taped down, those rugs can easily curl up and then you can trip over them. So making sure your rugs are tacked down or taped down somehow, or make sure, especially if you have the bathroom rugs or kitchen rugs, you have the grippy rugs so they don't slip from underneath you. Some other things to do is to make sure you have enough lighting in your house. And especially at nighttime, it's really important to have some type of lighting from your bedroom to your bathroom. That can be a high risk of falling. And I know people are like, oh, I don't really want to have a night light because that shines my eyes all night long. There are actually night lights that are motion censored. So when you get up, they'll turn on as you're walking to the bathroom, and then they'll eventually turn off when you get back. So those are some things that you can do to help mitigate some risks of falling. Some other things is making sure your room and your floors, they are removed of clutter. And so not putting your books on the floor or newspaper or magazine, because you can easily slip on those. And then just removing other clutter too around your floor. Being aware of where, if you have power cords in your house, being aware where those are, make sure they're like taped against the wall so you're not likely to trip over those. Some other things, I forgot to mention is on your stairs, especially I think about my neighbors, they like to have a lot of pretty flower pots on their steps outside. Those can actually be a hazard too, to increase your risks of falling. So making sure your stairs or your steps are clear of anything, even if it's nice, those nice pretty flower pots that we're starting to have out in the spring and the summer. And then one thing too that can put you at risk for falling is pets. And just, I'm not saying get rid of your pets or anything, but I'm just be aware where your pets are, because you can easily trip over them. If you have a pet, if you can either pick them up and move them over or give them a little attention so they can step out of your way. We just don't want your pets tripping you over.
And are there lifestyle factors that either make it more likely that someone is going to fall or make it less likely?
Yeah, so there are some lifestyle health factors that can increase your risk of falling. And I have to find my notes here. One thing I want to mention, I didn't get to mention this earlier, is falling is not a normal part of aging. I know a lot of people think, I'm getting older, so I'm going to fall one day. That's just a normal thing. That is not. You can actually prevent falling down. And some of the things that you can do to help prevent falling down is keep your exercise up, whether that is just keep yourself moving, being physically active, taking walks, doing your gardening, just become physically active. Because what happens when you get older, around age 50, you start losing your muscle strength. And then by the time you're 70, that muscle strength increases the loss that you have. And so we want you to keep moving. Having muscle will actually keep you stable, which will actually help you keep your balance better. So making sure you're moving all the time. Deterioration in your vision. So making sure you're working with your optometrist. And then having a disability or an impairment can actually increase your risk of falling. So if you do have something, a mobility issue, making sure you're using like an assistive device, like a cane if you need. And then some other chronic health conditions can increase your risk. But just if you have a chronic health condition such as like arthritis or Parkinson's disease, just being able to just know that, being aware and cautious, and as we talked about like earlier, the physical environment, making sure you're removing things that can put you at risk. A big one also is your type of medications that you're taking, both your prescription and your over-the-counter medications. Some medications can actually make you feel dizzy. They can make you feel confused or sleepy. So just being aware of what you're taking can help you. And then also alcohol. Alcohol can increase your risk of falling down. So if you want to have a drink, make sure you're limiting it.
Sure, especially with those medication interactions.
Yes, exactly.
Yeah, and it's even down to what we wear can help prevent falls. So making sure that your shoes are good. What other tips do you have?
Yes, so exactly what you improper footwear can actually put you at risk of falling down. So some of the things to think about if you're thinking, what kind of shoes should I get next? Making sure you're getting footwear that has a nice amount of tread on the bottom. Not to use the slick-soled shoes. When I think of slick-soled shoes, those are the cowboy boots. So making sure you're not, because you could easily slip on those because there's no traction. Other things are high heels can actually put you at risk for falling down. Making sure the shoes you do get have some type of back on them. I think of sandals like flip-flops or even slippers. Sometimes slippers don't have backs on them, and so you can easily slip out of them and fall, and then fall and trip over your shoes. So just making sure you have proper shoes that fit snug on your feet, and they're not too tight or too loose.
Perfect.
Other things are, having too loose and baggy of clothing that can usually get caught on door handles or furniture and make you trip and fall.
Great. Melissa, when we get back, I want to cover just a few more things that you can do in your home and your community and those classes that are available. So make sure you stay tuned.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked. But then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Summer in Montana is a great time to visit your local farmer's market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmers market.
Welcome back to Aging Horizons. Today we're speaking with Melissa Dale, who's the program manager for the Montana Falls Prevention Program. Melissa, we were talking about some of the things that you can do to help prevent falls in your home. What are some of the other tips that people can use to prevent falls?
Great question. So I want to reiterate just one more time. Falling is not a normal part of aging. So you can change some lifestyle modifications to prevent from falling. Some of the things you can do, the biggest thing is just to stay physically active, whether that is to be gardening or walking or something like that. Just as long as you're staying physically active, that'll help you maintain your muscle strength, which will also maintain your balance. So that is the biggest thing you can honestly do, is to be physically active. Some other things that you can do is to have your medications annually reviewed every year by either your pharmacist or your doctor. They can look at what you're taking. They can see if a certain medication might make you sleepy. They can give you recommendations that you should take that one at night so you're less likely to fall. Or they can see if anything counteracts with each other, and they can maybe help change dosages or anything. But talk with your healthcare provider and make sure you're taking the right thing for you. Some other things are using assistive devices. This can be walking assistive devices. So you can use a walking cane, you can use a walking stick or a walker. One thing to keep in mind if you're using any of those assistive devices, walking assistive devices, is to make sure you check the bottom of the, like your cane. There's a rubber tip at the bottom. And you want to make sure those are not smooth or worn down. If they are, you can go to the pharmacy, your local pharmacy, and grab a new rubber tip for the bottom, because if they're slick and they're worn out, you can easily put that cane down and then slip it out from underneath you there. So just being aware of how your assistive device looks like. Some other things that you can use is, I actually have an example here. This is an auto grab assistive device. I don't know if you can quite see it, but you can put this in your car, and then when you're trying to get in or out of your car, you can hook this in that U-shaped latch or striker and put it in there, and that'll help you get up or down inside your car. Some other things are you can use in the winter using what we call Yak Tracks. So you can put these on the bottom of your shoes if it's icy, and that they have little studs on here so you don't slip and fall on the ice there. And I don't have an example of this on my hand right but you can use those reaching grabber tools that have a handle at the end, and then almost like a claw thing or a clamp thing at the end. They're kind of about 2 to 3 feet long. So if you need to pick things up from up high or down low, those are great devices to use. Some other things to use is to invest in technology. Have the technology work for you. So either get a cell phone and make sure you're carrying that cell phone in case you do fall and you have access to be able to call somebody. Or there are those wearable devices And this might, if you get these, it might actually help keep you at ease and your family at ease too. So if you do fall, you have an assistive device, whether it's a necklace or a wristband, and you can call for help immediately. And so those are some things that you can use.
And Melissa, are there classes that people can take to either learn more about falls prevention or do some of that keeping active that people can do in their communities?
Being active, like you said, is really important. But there are some falls evidence-based programs that we have here in Montana. The first one that I'm going to talk about is the Stepping On program. This is the one that the Montana Falls Prevention Program supports. The Stepping On program is a combination class. There's exercise and an educational lesson in this. It's a 7-week class. We have them all around Montana. And so if you are looking for this class, I recommend, either give us a call or go online to our website, which we have a map on there, and you can go look on your county and see where that class is being offered and who's offering that class. The Montana State University Extension Office also provides a falls prevention program. It is called the Tai Chi Kwan. And that is also a great class to attend. If you don't have classes, like you were saying, just try to stay active. You can also take other classes that are geared maybe towards older adults that you can take, like water aerobics or Tai Chi too.
And if people have any questions, who should they contact?
They can give a call to us at the office. And our phone number should be right on the screen, and or you can look us up online too, and we'll answer where your classes are being located and who to talk
to. So on a yearly basis, people should really be checking in with doctors to make sure that their medications are good, that their vision prescriptions are good, and that none of their medications are interacting. And then on probably like a semi-annual basis, checking shoes, canes, walkers, any of those mobility assistance devices.
Yes. Mm-hmm. Prevention is huge. So if you can do anything to mitigate your falls by doing any of those, that is huge, and that'll help you not be as susceptible to falling.
Sure. I know in my house it's the clutter on the floor that usually gets me.
Yes.
Well, Melissa, thank you so much for being with us today. I learned a lot. I know that there's a lot of things that people can take from this and look around their rooms and make sure that they're a little bit safer. So thank you for staying with us today. We appreciate you tuning in to Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.